Hi, everybody. Welcome to another exciting webinar offering from all of us at the MaxWell Clinic. This evening, you have myself, Lindsay Jost, nurse practitioner, and Dr. David Haase, leader, founder, genius extraordinaire on all things MaxWell and how to better your health. We are here tonight to have an exciting conversation about why we are the healthcare that you didn't know you needed, because we are.
That was a great title that you thought of. It was really, really great because it's very important in healthcare for you to be selfish. It's healthcare in its essence should be selfish. Self-care is the point, your individual thriving. And so we'll be taking questions at the end. So if you have questions, make sure you put them in. This time is for you. We get the joy of talking about these things on a daily basis with individual patients, and we get to tell part of our story, but we'd like to tell a little bit more tonight. But we want to do it with the idea of what's in it for you. How can you become a greater agent in your own health and well-being? And we'll go from there.
I think resource utilization is really important, and your time is your most valuable asset. And we respect that greatly. So thank you for tuning in tonight, tomorrow, in the future, whenever that happens to occur. And I think we're going to dive right on into who we are, why we're here, what we value, what we love to do. Would you like to start with your?
Sure, absolutely. So, MaxWell was really thought of as, how can we create an environment that enables the body to do what it does best, which is create health, and to be really curious about what are the things that are holding you back from thriving, and how can we find what those are, and then how can we provide the resources necessary to do interventions to help get you back on a path that is actually helpful. And Lindsay, as we think about MaxWell, I'd love to hear how you kind of came to MaxWell.
I was just going to ask you.
You have an interesting story.
I do.
People have heard how I've just always been here. I'm like a relic. So.
You're the OG.
I'm the OG.
You're the OG. Well, I do think, I will say, I do think it is interesting to hear how MaxWell came to be. And that is really your origin story as well. So, well, I wouldn't cheat the crowd with not.
All right, fine.
With not saying that.
Well, it came out of a whole bunch of factors, but the big aha for me was when I was in Mayo Clinic in my residency. I was in the hallway and it just hit me all of a sudden that listen, what I went to medical school for, I went to Vanderbilt to medical school, and I was interested in research. Everything I was doing, I was actually trying to figure out, how do we create health? And what I was being taught is, how do we diagnose and treat disease? And it's super important to make a great diagnosis and then treat appropriately. That is a very important part of healthcare. But there's also this really cool mystery that happens that I was surprised by seeing, in that, when a patient goes into surgery, and surgeons know this best. It's really funny. Surgeons really get functional integrative medicine quite well, because surgeons are there to cut out something that is unhealthy. But they also know that it's the body that does the healing. The body is what knits all that back together again. The body is what overcomes the cancer from an immune standpoint. The body is what does the work. And I'm really fascinated with, how do we take all this data and all the science about how the body heals and apply what we know to helping people create health. And MaxWell Clinic is our laboratory for figuring that out, one patient at a time, because every person is an experiment of one. Now, if you think, oh, that sounds weird, like, wait, so you're experimenting on me? No, you are experimenting on you.
All day, every day.
All day, every day, because nobody like you ever came on the face of the planet. Nobody's had the genetics and the exposures and all these other things. You are what we call an N of one, a study of one participant. And you are running this giant uncontrolled experiment we call life. And so I wanted to have a center that would help people embrace their individuality, to go after what they specifically wanted in their life, and to think about how do we do that in the safest, most direct way possible, to enable their miraculous body's ability to heal. And I can't say it enough. If just take a little time right now, just take a little time and think about how many things you have healed from, how many challenges you have overcome in body, mind, spirit, psychology. I mean, we are miraculous creatures, and it's fun to see how we can do that better at higher levels. So that's how MaxWell Clinic started. I needed a place to practice. I never wanted to have a medical practice, but I needed to have one.
Well, I think you really brought up something that makes us so incredibly unique, and that is the personalized and individual style of medicine that we do. We really value each person's unique story, history, what they're looking for, their life goals, their aspiration, their family of origin, their chosen family, their entire life picture. And then we have this gift of discernment to help them move forward with how to best utilize their precious resources. One of that being time, effort, and energy. My personal MaxWell story is a really fun one. So when I was young, I was going to be a doctor. I knew that from the time I was in single digits on, it was going to happen, no question. Born a healer in my mind. And my family had some autoimmune challenges. And so I was really focused on dermatology. This is what I'm going to do. And then, 6-year medical school, this is where I'm going to go. This is how I'm going to practice. Anybody who knows me well knows I like to check a box and get something done and achieve it if I put my mind to it, and I was going to do it. And so the greatest gift happened after I went to college. And that was, I was waitlisted for medical school the first year. So I thought to myself, okay, well, then I'm going to bolster my resume because I'm going to this one school. I did not apply to very many others. It was this, very focused. And so I started working in the hospital. And what I noticed, because I was a nurse's aide at the time, and I fell in love with bedside care, fell in love with being a nurse. I thought to myself, if I could be a part of some of the most intimate and transformative moments and vulnerable the moments when humans feel ashamed and scared, and I just could deeply connect with people and care for them and make them feel safe and warm and comfortable and cared for, I wanted to do that for the rest of my life. So it caused me to change trajectories and go down the nursing path. And I've done so with gusto. Did some travel nursing, and I was in the inpatient scene and looking at how healthcare was done, and was really uncomfortable by the system at which people were put into, the room numbers that we started to refer to patients as, the chart number that they became, the diagnosis that was, oh yeah, that guy in room 4 with this condition. And we really lost sight of the individual human and what their passions were and what they were uniquely contributing to the world and what their soul was seeking to express and how they felt loved and cared for. And it became, and then I was watching the diets at the hospitals that we were giving people, which is laughable.
Die with a T.
It's your diet, the sugar, and it just didn't feel congruent with what I thought was possible. And so I got to find MaxWell very serendipitously and found my home here, and wouldn't have patient care in any other way. I deeply value what we get to do every day. It's very special.
And I think the collaborative approach is also something we embrace. I have a huge respect for nursing. My college roommate forever, Dan, if you're watching, love you, was the only male in a class of 51 nurses. And so I got to be an honorary nurse going through his nursing school. And it was amazing to kind of get to see nursing through those eyes. He would call me up like every other week or so while I was in medical school, and he would say, "Hey, I just want to know, are you an asshole yet?" And he said, "I just want to know when it happens, because you weren't one when we left college, but it happens." And so this everybody doing what they are uniquely drawn towards doing. Lindsay, and it's so interesting. We have a group of many different clinicians here, and they have different areas of focus. Some are really focused towards autoimmune disease, other towards neurologic disease, some towards neurodegenerative disease. Performance enhancement,
Mhm.
Hormones. We have a musculoskeletal regenerative medicine doctor, former Olympic athlete, Dr. Stoll. There's so many unique components, an amazing nutritionist, a spiritual psychotherapist, a ketamine psychotherapist. We have a family of uniqueness here. And I think that's what's important, because the thing that bothers me about healthcare, and you think about what you don't know you need, is that oftentimes your own bias, the way you see the world, what you know about healthcare. Like, I know, hey, I know I should exercise. I know I should eat better. Yes, all those are true. But do you know what effect a chronic infection with mycoplasma pneumonia could do to your elevated levels of inflammatory markers, which cause a feed forward worsening of inflammatory and autoimmune disease? There's a whole bunch. You don't know what you don't know. And that's why you engage specialists to say, hey, dig into this for me. And we're really proud of the breadth of viewpoints that we take here. We start by listening, because you know your body best, right? You know your life experience best. And then the point is to say, when were you last really well? And start to dig into it from a first principles standpoint.
Well, we're talking about collaborations and all of the different viewpoints we have here. We can't not shout out to the backbone of our clinic, which is all of our amazing clinical support and administrative staff as well. We'd like to talk about everybody who works here being a healer, and we get to see that happen every day, from the first person that greets you when you walk through our doors to the last person that you talk to as you're checking out. It's just this is an incredibly transformative and healing space just unto itself. So what I'd like to do is come back a little bit to why we value what we value. We've mentioned it a little bit, but there are some first principles that we kind of stand upon, if you'd like to go into those.
Well, yeah. So I think one of the most important principles for me is that this miraculous intelligence which made the body is what heals the body. Right? It goes back to this idea of health. And that's a principle that we can kind of anchor around and recognize that, oh, that's true. So how can we utilize that? Another principle, I love the laws of thermodynamics. I mean, talk about, I know, nerd, right? So the first law is energy cannot be created nor destroyed. The second law is really that, if you, in a standard system, that things are going to increase in entropy, and that and the third law is that at 0 Kelvin, there is no energy in a system. And now I know that sounds kind of kooky, but what is entropy? The laws of thermodynamics are all about how things burn. And if I can summarize the decline of health in one term, it's how fast are we burning? How much inflammation is there? How much oxidation is there? We know time comes along and causes erosion and friction and heat and pressure. So one of the first principles we think of is, wow, there's this miraculous intelligence which helps organize this body into something we call life. And then we go like, wow. And then there's all these forces that hit us that cause disorder and a breaking down. So what would be wise for us as a first principle is to be really curious about what are all these factors that are helping support the process of healing, and get more of those. And what are all those factors that are increasing entropy, or the tendency towards disorder, and identify those and remove those or retrain those. And if we, so really what we are doing is going back to some of the most fundamental laws of physics and then applying that towards healthcare. One of the reasons Elon Musk has been so successful is he's gone back in his view of like SpaceX and Tesla, and said, hey, how do we go back to first principles and build a rocket ship that's 10 times less expensive than other rocket ships? And that's what that's part of our thought here, is to always be curious about, how does the world work? I mean, how does reality work? And now how do we practice medicine in congruence with how we know the world works.
How do we harness the foundations and the basics
Yeah.
of what we've already learned? Let us
Right.
not forget the wisdom that we already have.
Yeah. Another principle would be that, well, it's not really a principle, but if we think of most medications work as an inhibitor, a blocker, a stimulator. They make the body do something that it wasn't doing originally, right? Now that may be beneficial for us in the short term. That can really save a life and it can be amazing. But if you constantly block, suppress, or inhibit something, the body pushes back. So that's another principle, is that, this ability of the body to heal is going to try to find a way around every poison and toxin that there is. And
Because it survives. That is what happens.
Yeah. And so seeking to understand how the body functions is really important. Like, I'm one of my own, oh man, my health. Oh, I would just take it a little. I never talk about this story, but I didn't really realize so many different interesting things happened about how my own health declined. Because I just all of a sudden found myself one day taking acid blockers and anti-inflammatories and things to help my mood and things to help my energy and things to help my focus. I was just on this long list of medications, and I started tracing it back. There were injuries and there were traumas, and there were all kinds of things that happened before that. And once I started to figure out, oh, that was where that started from. For instance, I had terrible plantar fasciitis. I couldn't stand during rounds in medical school. Oh, it was terrible. I would just dance around, moving my feet from one side to the other because my feet hurt so bad. And I knew I couldn't go into surgery because there's no way I could stand that long because my feet hurt so bad. And I just took tons of ibuprofen and naproxen, tore a hole in my gut, caused increased liver enzymes that increased food sensitivities, which then perpetuate on to more inflammation and more problems. But that plantar fasciitis started from me injuring my back, having a slip and a fall during high school. And when I had my back, some of my ligaments repaired through prolotherapy, one of the services we provide here, a doctor put an ultrasound over, found those ligaments that were injured, injected them with some substances that helped ligaments heal. Within the course of about 4 to 5 weeks, I wasn't expecting my feet to get better. I was not. I was just trying to treat my back pain, but my feet got better. All of a sudden, my plantar fasciitis went away. And it just hit me that, wow, the search for underlying causes is never a bad investment of resources. And that, oftentimes the thing we have to do is be curious.
Oh, right? You just nodded to one of my most favorite concepts that we have here, the idea of the tensegrity, right? Back, foot, how could that possibly have all worked together? Which goes into why we have such a unique approach. How would you describe that?
Well, I mean, I would say, because we have the pleasure of getting to take care of people from across a wide variety of humanity, very wide variety of humanity. And we can do very, very, very deep dive work in individuals, and we can and work on individuals that are really are struggling to, take whatever next step is there. And I would say it always starts with relationship. It starts with relationship. And it doesn't matter how many AI programs are out there that you put your symptoms in and, oh, it's going to barf out, an answer to
like
you.
the Dr. Google.
It's going, people are going to recognize again that one of the magical parts of healing is that it always happens in relationship. Healing is actually making things whole. That's what heal and whole come from the same root word. And so healing is to make whole. And so that means to put things into right relationship with each other. So the way we first start is with interaction. Interaction and being,
we listen,
having a good conversation.
Yeah.
And then after we listen, then the question is, what kind of investigations do we need to do? we make a hypothesis, right? We listen to your story, but every person is different. And I hate it when people will say, oh, all disease begins in the gut. No, it doesn't. Okay. No, it doesn't. It's all disease, it's all infectious disease that causes it. No, it doesn't. Or it's all 5G,
Oh, that's
or
the hammer
it's all,
nail thing.
that works for marketers, but it doesn't work in medicine.
That's not
It just
human.
doesn't. And while all those, who knows what causes what until you are successful in healing that problem, right? Results are the only true gold standard. So anyway, we interact, we investigate, and then we intervene. And so whenever we are intervening, we try very hard to work with the things that can cause least harm first, because unfortunately, the history of modern medicine is filled with clinicians causing harm to patients. Institute of Medicine, one report showed that doctors and properly prescribed medications, yes, properly prescribed medications, are possibly the fourth leading cause of death in the United States. That's crazy, right? And so, but I was in medical school when Vioxx came out, and all the data on Vioxx, it was very clear that it causes increased deaths for heart disease when it was actually introduced, and nobody paid attention. And it was over 100,000 deaths later before Vioxx was pulled off the marketplace. So anyway, we focus on doing interventions that cause the least harm first, and that's behavioral, right? Lifestyle.
Diet, lifestyle, supplementation. Sometimes it's getting support for relationships you may be in that are causing more stress than you really realize. That could be possible. Absolutely.
And then we progress on to things like neurofeedback. Neurofeedback is another principle of what we do, is that each person is so miraculous and sacred. And part of what makes that is that it's a consciousness. Each one of us are this miracle of self-awareness. You think about for a second, the rocks, the animals, they don't know that they're aware. They're not struggling to think about, well, what am I going to do tomorrow? What am I going to do next month? Or this miraculous part of being conscious and being aware of ourselves gives us an incredible amount of capacity to be reflective and to heal. And where's consciousness basically stored? It's in the brain, as far as we know, right? And somebody gets their head whacked, they become unconscious. So the brain is really a centerpiece of the therapies that we do here. We've been doing quantitative EEG, which is measuring brain waves and analyzing those objectively. We're doing that for over 14 years. Been one of the leaders in that field. We have multiple. We just had a very interesting interaction with a new patient that had a terrible stroke at a young age, and very excited about working with that individual towards utilizing neurostimulation, neurofeedback, transcranial photobiomodulation, which is using photons to help the mitochondria in the brain have more energy, and pairing that with hyperbaric oxygen therapy. And as we do those together, in partnering with some physical therapists and occupational therapists that are going to help that individual mobilize, I'm very hopeful to see that we can have incremental improvement beyond that, where they've gotten stuck. The brain is our center of well-being and function and symptoms. And my gosh, I just don't think we can do too much to help brain function occur. So,
fundamentally, what is so starkly different than the conventional care world is that belief that the body is designed to heal. Because no matter what, any clinician that you are interacting with at the basis believes that your body can, will, and could heal. That garners a certain level of hope that I think is invaluable. My own story, each of us have had unique journeys. My own story involves a construction issue is what it was called. For those of you out there who have ever heard of the Chiari malformations, that is something I discovered that I had whenever I was in my 30s. And it's a little spot in the brain that is kind of protrudes a little bit into the spinal cord region. And so it's an actual space issue that seemingly would only be able to be solved from surgery. However, because of this,
Three surgeons said
three
so.
surgeons,
Three surgeons,
Yes.
three surgeons said, okay,
well,
just tell us when you want to schedule. When your pain is bad enough, we will do this because it's the only thing that's going to make a difference.
yeah. And, it's unbelievable that not only have I not had brain surgery, I am functioning at a higher level today than I was before the discovery or before going down this path. And I truly believe that if I wasn't placed, my feet planted here in this unique environment of how we approach patient care and knowing that the body has thrived, it can thrive, it will thrive again, that there are different ways and modalities that's my own unique recipe to put together to be able to not be in pain and to function at the highest level possible. So it gives me goosebumps to think about the work we get to do every day, but the hope that we get to give people and the miracles, the story that conventional physicians and teams would think we actually have been told is not possible. We see possible.
A couple of things I want to share about what you just shared, because I'm so glad you didn't give your recipe. All right.
No.
I mean, because this is what, and believe me, it's cool. It's not things you would expect. And right. And so, because every person is unique, right? And now, sure, isn't it fascinating when 10 people are exposed to the flu? All 10 people have a different manifestation of that, right? They don't get the same disease. Some people don't even know they got exposed or got ill. And some people are on death's door, and there's all kinds of variations in between. You can't even say that the influenza virus, does the same thing with every person at every time. It's contextual, of that. And I think in your process of figuring out what were your triggers, what were your antecedents, what were your mediators in this process, gave you a tremendous amount of wisdom. And then when you applied that wisdom, you got side benefits.
Right.
Right. And we talk about side effects oftentimes in medication, but if you're finding and addressing underlying cause, you should get to experience side benefits because you are creating wholeness, and the wholeness finds a way back towards health and healing. The other thing I want to say is that I really believe that so many clinicians want to practice this way. And I know that because we have so many physicians and nurse practitioners as patients, number one. And they're always like, how can I do this with you? So many people are getting trained, but they don't really have a place to do that. So if all of you know doctors that are really going down this path, we love what we get to do. We love the practice of medicine. Now, do we have it figured out? Absolutely not. Okay. I mean, absolutely not. I mean, if you want to be humbled, just start practicing medicine, because when you're interacting with this miracle that we call a human and doing your very best to help that person move along towards a state of better well-being, if it doesn't humble you, then something's not connecting. And so I think we are here. We're not here to actually run a clinic. I mean, that's what some people are like, oh, this is your clinic, this is what you do. Actually, we're here to help transform the health of humans and healthcare systems. I mean, we really want to do our part, whatever part that's going to be, to have an ever better medicine. So,
we're at this really interesting time in medicine where we have the internet. Thank you, World Wide Webs, which I know you spoke to Chat GPT and things like that, but we also have these, this biohacking movement, this longevity movement, this, if I take Metformin, then I'm going to live longer. If I do, this specific program, then that works for everybody. And we see that a lot out there. I think that is something that we should speak to because it's becoming more, with information being more readily available, it's more popular to even have these conversations with your friends in a coffee shop about what you read in this article. And are you going to start taking this? And, how do you know what is going to work for me? Because there is a chance that if you just take Metformin for longevity, for example, but you have a genetic abnormality you didn't know you had that could actually cause you to have worse outcomes, but not know it because there isn't that person there to have the discernment of what's best.
And also, why would metformin work, right? I mean,
we got to talk about
no, it's really interesting.
Yeah.
It's because metformin inhibits. Come to our clinic and you can see our wallpaper.
Oh,
And
yes, come. That is interesting.
I mean, it's like our wallpaper has a large portion of the metabolic map listed out, so you can see the Krebs cycle and its interaction with the electron transport chain and heme biosynthesis. Anyway, the bottom line: how does your biochemistry work in your body is actually mapped out, and I'm so proud that I found a way to make that into wallpaper because it brings me joy. And
I have to give a shout out to Michelle for a second, our communications and marketing director, who one helped coin the name of this webinar tonight. Thank you, Michelle. And two, made that wallpaper possible.
Did make that wallpaper possible. Thank you very much.
Yes.
And so what was I talking about?
Why would metformin work?
Oh, they're metformin, yeah, because I get so excited about the wallpaper. But metformin inhibits a certain couple of enzymes in the electron transport chain. It actually it causes a little bit of stress, and then the body pushes back against that stress, and it's the pushback that gives the benefit. But what other things cause a similar stress to metformin? Fasting mimics it, and actually we should say metformin mimics fasting, and fasting can do way more than metformin can. Exercise has some of these very same effects. Choosing a diet where you're not slathering yourself in sugar, raising your insulin, raising your inflammation, and doing all that also has effect. So the individuals who are doing all of those things, metformin may actually be a net toxic effect. For the individuals who are doing none of those things, or really are barreling on towards becoming pre-diabetic in their life, then okay, well, maybe that has a longevity benefit. So everybody has a different level of resource, not just of money, but of time, of their focus, of their follow through, of their initiative. And one of the things we really try to do is listen to, what are the resources you have? How can you apply what you do have towards your best end? I mean, at the end of the day, a lot of healthcare is just how do we allocate resources? And we try to do that as wisely as possible.
Could you say getting the biggest bang for your buck?
Sure. But it's also getting the biggest bang for your minute, and for the biggest bang for your effort, and the biggest bang for your support and relationships. It's not, all too often we get stuck in a monetary mindset. And listen, money is great at basically contracting time. Money, can give us shortcuts, but this body is designed to heal. And if you're willing to put a lot more time and effort and energy in, you can get by with a lot less finances in doing so.
And have more good days.
And more good days.
I got really excited earlier because you described how IV ozone works too.
Oh, so talk about that for a second.
The idea of putting a stressor in and then the body responding is essentially how IV ozone works. There's a lot of therapies that work really well that way, but as you're describing it, that's where I got really excited.
Yeah,
I could hardly control myself.
And many of you have never heard of IV ozone, and it is one of these therapies that has had dramatic improvement in people with chronic fatigue, chronic infections, oxidative stress, inflammation, autoimmune disease, and
COVID,
it's really
long COVID too.
And we've seen nice results in long COVID, and I think that is, but knowing what works for whom when, I think that's always our greatest challenge, and really what we're here for.
Yeah, absolutely. So what makes us also very special is that we have a 12,000 square foot? Mm-hmm. We have a 12,000 square foot facility where we house and access to a lot of therapies you may have heard of all in one place. So not only do we have these incredible clinicians, we have a program called MaxWell Care. If you become a patient with us, you have a nutritionist support, you have a clinician who's going to have that longstanding relationship with you, exercise the discernment and what works best for you. All of that here in one place. We've got an advocate team for support. We also have a lot of additional services, therapeutic plasma exchange. We have a clinical research center. We have an IV suite that has IV ozone, IV NAD, IV vitamin C, alpha lipoic acid, just to name a few. We have a neurofeedback center. We've got IV ketamine. We do sublingual allergy drops. We have hyperbaric oxygen. We do something really cool called the glyco check that I don't think a lot of people know about, and many more. There's just a really short list. So we have all of that here, and our clinicians are expert at helping you discern, where do I go next? Oh, I failed to mention the over 35 specialty lab companies that we have access to outside of your standard LabCorp, Quest, or all the testing that's available there. So not only is it what services do I use for my body to heal, but also what testing and evaluation do I need next to be able to determine what's going on and how to best utilize my resources. It is something very special.
It's just fun.
And it's fun.
I mean, and I know that sounds, and I get to, because when you're called into something, and this is why we call people that work here healers, because we believe that if you're in healthcare and you're not in banking or in like auto repair or something like that, there's a reason you did this. There's a reason you did it. You feel in your heart that there's something about being of service to another person's thriving that is just what you're made for. This is just what you do. And I would call that person a healer. And I think that's, it's so amazing how many of our former patients then become our employees, because they go like, oh, I get it. I've always wanted to do this. So, and oftentimes we don't recruit out online because people just hear about us and they say, hey, that's the kind of place I want to be. So if you're one of those people, let us know. We have open positions that we're being made all the time, actually. But I wanted to come back to this, there's this dizzying array of services, and you do this, that, and the other. And, we do
so much.
We've been doing IV therapy for as long as the clinic's been open, about 19 years. There's a lot of places that are popping up and like, oh, here's this IV center on the corner, or here, go get your hyperbaric oxygen here, and I'm all for personal choice, right? I think healthcare freedom is one of the things we should be fighting for. And I'm kind of glad to see these things pop up. But I'm also a little sad because people are often not getting as much they're not getting as much benefit as they deserve, because they are just doing what their neighbors said they thought they should do. And so we're trying very hard to nudge people the way that they're going to get the most benefit from their limited resources. And I say limited resources, we've said that a lot, but healthcare is very unique, right? Healthcare is this amazing space where we have unlimited desires and we have limited resources. And that's just the way it is. And so that's why every healthcare system is rationed. Doesn't matter if it's a socialized system or a free market system or a total non-system. There is a limitation of time, money, energy, and effort that exists. And the human has no bounds with regard to how long they want to live and how healthy they want to be. And so there's always a judgment call here. And what I love about, we left insurance entirely about 3 years ago, and what has happened, and I got to see this happen in my own practice and the practice of other clinicians, is that the sacred relationship between a clinician and a patient escalated. Now all of us, the problem with having an insurance company is it's almost like you have another person in the room with you when you're being seen by your clinician. There's always somebody you're thinking, okay, are they going to pay for this? The doctor's thinking, how do I code this? What are the magic words I have to put down? How do I solve this puzzle that is the insurance payment industry? As a result, they're not trying to solve your health puzzle. They don't have the time or the bandwidth to do that. That's not their fault.
What box do I put this person in?
Oh my God. Oh my God.
Yeah.
And so the stress that goes under it, because then you just have to kind of start ratcheting people through, because it's a system, and then you can provide good care. Please let me not I just have so much respect for my colleagues in all of healthcare. Everybody's doing the best they can, and we're all part of the same team. So I don't have
You're just
get to
bringing
learn
forth
from
the
everybody.
challenge that can bring.
Yeah,
Mhm.
because and so if you have that other person in the exam room with you who's listening in on, this intimate conversation, it's just not like it should be. It should be intimate. Healthcare is one of the most, it's a place where we are the most vulnerable. I take very seriously, as all of our clinicians do, the vulnerability that happens inside an exam room, the things that are shared with regard to the hardest things happening in one person's personal life, in their past, in their early life, their hopes, their dreams, their challenges, how much shame they may have around the things they've been able to do or not been able to do. And our job is to create a healing, wholesome, welcoming space for that vulnerability to come forth, because through the vulnerability is where we start to see new possibilities happening. And that's just
When
that's an honor.
when knowledge transform, we get wisdom.
Hmm.
And I feel like our clinicians are a fulcrum for human transformation. And it's really beautiful to see. Mhm.
That's awesome.
So I think
We have a question here. I think
We
I'd
do.
love to take this if we could.
Yep.
Um,
Would you like to start with the first one?
Sure. This is great. And I'm going to just read this question off because I thought it's so good. It said, "Thanks for addressing that sometimes as patients, we don't know what we actually need. That's what I'm struggling with now. I've had a Lyme diagnosis last year, and I'm currently going through a series of specialists to try to figure out exactly what I need to do going forward, including find out that I have mitral regurgitation. I am, I'm going to go say the specialty. I'm not going to say the occupation because I always want to be super careful about confidentiality, but somebody who's very precise in their work, kind of like an engineer. And the analogy I use is that we'd never build a building by each designer working on the blueprints in a vacuum. But that's exactly what the medical system seems like. A bunch of specialists working on the project, but without doing so in a collaborative way. Thanks for offering a smarter way." And I think this is, first of all, thank you for those reflections. I hope we live up to those expectations. I mean, it is a really challenging work to attempt to do this well. And it requires a good conversation between clinician and patient, because when we're not getting it right, we can only know that through the patient saying, this isn't going well. But I want to say that it's always blows my mind how patients, once we describe what we're doing, trying to do more, bring more good things in the body, take more bad things out, retrain dysfunctional cycles and repair damaged tissue. And that's pretty much what we do. They all go like, well, that makes a lot of sense. That makes a lot of sense. This is a rational medicine. And I think that it's maybe we hope to be smarter, but we definitely know that we're trying to be more rational.
Well, what this particular individual spoke to was specialists working in vacuums. Something I think our team does really, really well is we don't bad talk other styles of medicine and clinicians out there. We really enjoy taking exceptional care of you and being the quarterback to help you discern all the information that you've received so you know where to go. And oftentimes we can pick up the phone and call your conventional rheumatologist or endocrinologist if that's what's needed, if there's additional questions to help kind of focus and discern where to go from here. So I really enjoy the collaborative environment that we've created as well, in respecting all of the available conventional care that's out there as well. Too often, physicians will kind of undercut each other to patients, and we don't do that here. And I think that's beautiful.
Listen, we are all here walking each other home, right? At the end of the day, none of us is omniscient. None of us has all the answers. And we're all trying to do the best we can. I really believe that. And I would say that I do want to make another comment about the Lyme diagnosis, because I'm really glad that you've gotten some help to find that a diagnosis. It's a very difficult diagnosis because it's a clinical diagnosis. Laboratory tests sometimes aren't as helpful as you'd like them to be. And there are some clinicians who everybody who walks through the door is going to be called a Lyme's patient. And then there are other doctors who doesn't matter how flagrant Lyme disease is, it doesn't exist in Tennessee. And, there is that entire spectrum that exists. And so getting second opinions or just doing your own research and trying to figure out, because many of the things that cause the Lyme disease causes symptoms that overlap with a lot of other conditions. And that can make it really challenging. So anyway, just want to say that out there.
So our next question here is if we're taking new patients. Yes, we are.
Mhm.
Yes, we are. So feel free to call in and inquire further. We would love to take care of you.
Go to MaxWellClinic.com and there's an intake process in there. And we do a lot to match clinicians or patients with the clinician that it would actually be of most benefit to them. So another good question is, do you help people who need to lose a lot of weight, like over 100 pounds, without embarrassing them? Oh my gosh, thank you so much. I love that question. Weight and shape has actually been a real struggle of mine through my lifetime. And I really expect I'd probably be about 400 pounds right now if I didn't know some of the things that I know and the things that were there. And I have felt the huge amounts of just shame and all kinds of horrible self-talk as a result of going, I should be this way, or I should have this. There's a huge genetic variability that happens, number one. But being curious about that genetic variability can open huge doors. And also recognizing that our body is designed to protect us, right? I mean, excess fat pounds somehow are serving a purpose. A couple of purposes it can serve. In high toxic levels, toxins actually go preferentially to fat. And it's a great way to shove toxins where they're not going to cause problems to the other parts of the system. If you happen to be eating way too much glucose or something like that, then it's actually healthier to make fat than it is to become insulin resistant and develop diabetes. So a lot of folks that have excess body fat their body's trying to protect them from a metabolic catastrophe. That's pretty awesome. And so no, I mean, I can say the view that we strive to have is that each person is a soul, and, an infinitely valuable, sacred soul. And that honoring that human as infinitely valuable is probably one of the most important parts of healthcare. And we can always do better at this, right? We can always do better at this, but please don't give up hope. The body is designed to heal. And anyway, thank you so much for sharing that question.
Yes. And I will say, just to piggyback on that, we do take any experience that has been traumatic for you on your healthcare journey very seriously. And we're very comfortable in bringing up the topic of possible trauma and opening the door to get support for that in a really collaborative way. There was a question about if we employ pharmacists, and not yet. However, of course, I think there could be a use for a role of a pharmacist here in the future.
Yeah, and believe me, we are here to be, servants towards better healthcare. And I just, I have been dreaming of having regenerative orthopedics in this practice for a good 10 years. I actually know how to do prolotherapy and PRP and some of these things, but you can only do so many things in a day. And just voila, what a doctor walks up to our front steps, who happens to be know another doctor that's here, and through a beautiful relationship, we have this 20-year expert of regenerative orthopedics that is now at the practice, Dr. Scott Stoll. And if you don't know about regenerative orthopedics, so much of our joint problems have to do with our ligaments and our fascia being injured, and that causing malalignments and increased wear and tear. There's so much you can do with a technique called prolotherapy and PRP, and you can get rid of that pain long term by healing the system, not treating the symptom. And that is so powerful. And so there are people who just show up here, and it's been happening again and again and again. And I know it's going to continue to happen because we are MaxWell. That means all of you out there, we are smarter and better than me. It's not about any one of us. It is really about all of us.
You just described another stressor with prolotherapy. Little stressor induces healing. You just said musculoskeletal, and I'm over here like can't help it but stretch my neck. We're so suggestible. So let's see. Oh, thank you. We had a patient type in that she's been with us for 19 years and love us so much that we're amazing. Thank you so much.
Love you too.
We love you too.
And listen, I'm not afraid to say that we love our patients.
No,
I mean, good gosh, we, the goal is to leave work with more energy than you came, right? I mean, because that means that you're doing something. Now, the work is hard. I mean, I can't say that we accomplish that all the time, but we know that when we feel expended, we know that we have invested ourselves in someone else. And that's really that's an honor to get to do.
We have a question about what are the most common conditions you tend to treat at the clinic, and what kind of success rate would you say you have? Do you make referrals, or is all treatment done in-house? Oh, that's such a good question. Most common conditions are all of them. No, I know we've run analytics on this before, and it sounds vague, but there really isn't a diagnosis we probably haven't seen walk through the door, or at least one that is related to the one that is walking through the door, and know how to make referrals out of office if need be. All the treatments that I listed earlier are done in-house. However, we can refer, and we have helped.
We do a lot. We refer a lot. We have
places if we need to.
We have a huge network of specialists and collaborators around town. But I would also say this is part of I'm going to pick on you a little bit. Questioner here a little bit, not personally, but this idea that, what conditions do you treat may actually be part of our problem when we start to look at this issue, because a condition can be a diagnosis. And as soon as we start to label something, there's a part of our brain in medicine that turns off, right? Oh, you have Hashimoto's thyroiditis. Okay, whoop. Now let's treat the disease. And then, but why did it occur? Oh, nope, don't need to do that. We already have named it. Diagnosis is what's important. And sometimes people will be a little frustrated because they'll go like, well, what exactly is my diagnosis? And then we'll go like, well, you have this central problem, and you have these 6 underlying, contributing causes. Yeah, but what's the one label for me? And sometimes we can get to that label, but it's a lot more accurate to be talking about what manifestation does somebody have, to rethink the problem that is there. Now, that being said, we treat a tremendous amount of brain disorders. Mm-hmm. So neurodegenerative disorders, neurofunctional disorders, mood disorders, energy, attention,
fatigue,
lots of work with fatigue.
Yep, we got some hormones in there.
But we have 2 IRB approved trials that are going on right now. One of them is looking at plasma exchange as the most advanced way of promoting healthy longevity, actually treating age itself. Very proud of that study going on. And we have another study that's we're recruiting subjects for doing plasma exchange in Alzheimer's patients. We know that slows progression in Alzheimer's disease via the AMBAR trial, a good set of evidence there. And then we'll have another trial upcoming. Question, do we work with osteoporosis patients? Yes, we do. Mm-hmm. And again, it's not an isolation. We don't know everything. We have our areas of expertise. But if you need a great endocrinologist, or we need to work with an orthopedist, or what that happens to be, yes. we've been very successful at helping people to preserve their bone mass and actually to grow it. But the real question, if you have osteoporosis, why'd you get it in the first place, right? What and I hate to say, and then osteoporosis is actually a very interesting question because there's so much correlation to dementia, because the osteoblasts that are actually those cells that make new bone have a lot of, or the cells that make bone and destroy bone and help keep bones healthy actually have a lot of correlation to the same types of cells in the brain. And so the microglia are very similar to the osteoclast. And so it's really important to think of these degenerative conditions, one like osteoporosis, and then step back and go like, oh, what is this telling me about the system as a whole? And what common underlying factors could be addressed so that we could make a difference in multiple conditions simultaneously and get the advantage of side benefits. Hormone replacement therapy is one of those.
I will say, I think we missed the autoimmune bucket. We do all autoimmune conditions, thyroid, like we have Lyme patients, we have infectious disease patients, we've had Parkinson's patients. It's in the neurodegeneration camp. I'm just trying to further fluff the fact that we've got experience in those
and again,
things.
it's not, because there's two buckets, right? Diagnose and treat disease and create health, right? It's a both and, we want to make sure that we're dealing with that as well. So, I want to really thank you all for this time. I think this has been it's been really gratifying to have this conversation back and forth. And if you have any questions, please go ahead and send a message in to maxwellclinic.com. Those things, other questions can be addressed there. You can find out more information specific to your particular concerns. But I just want to encourage you that your body is capable of healing. And, and if Maxwell Clinic and our clinicians and tools, things like that can be part of your journey, we'd be honored to do that. But if not, please just be curious, try something new, have hope. Your body is designed to heal. And of that, I have absolute 100% certainty. And so anyway, thank you very much for taking your time and part of your evening to be with us today. It really is. One last, you wanted to share that last little.
The last one. Sure. I am one of those folks who has been on board almost since Dr. Haase opened his doors. I used to commute to Clarksville because he practiced the type of medicine I knew had to exist. He wanted to find out what caused the problem rather than just treat the symptoms. I'm still in Maxwell Clinic system and I will be until I get kicked out. Thank you for all you do for folks. We love you so much. Thank you, everybody. If you have any additional questions, reach out to us and we look forward and hope to see you around the halls soon.
Okay, bye now.